Hello.
Very good evening, all the medicos. We are having the honor to have Dr. Alapan with us, rank 44, last INICET examination. So, beta, we congrats you on this big achievement.
Thank you, sir.
How you are feeling now, beta? Being an intern, getting rank 44 in the first attempt, what is the feeling?
Sir, I am a little bit more relieved than happy. The rank in itself, like more importantly, I think the fact that I can pursue my dream branch in my dream institute, that is what matters more to me than the rank itself.
That's very true, beta. And being from AIIMS, you want to do post-graduation from AIIMS. Which branch you are planning to join, beta?
So I'm planning on pursuing pediatrics, preferably from AIIMS New Delhi. If I get it here, well and good. Otherwise, I will pack my bags and go to PGI Chandigarh.
That's great. I love the confidence for telling. That's great, beta. So I just want we should use this platform to share like all the medicos across the country listening to you. So being an intern student, beta, when you started this preparation, in which year you started your preparation?
The first time I was really serious, I have to have like a post-graduation, like dedicated preparation was around in my third year. So in my sixth semester, I started. Like before that also I had DAMS in my second year, but the fact that I am preparing for PG came in third year. Then slowly over the years, first 1 year I got my notes settled up. Second year I finished whatever remaining. I mean, the final year I finished whatever like remaining work has to be done. Then towards the end I started like revising, and internship went completely in like revision. I had all my notes completed before internship.
That's great, beta. You completed your notes before the internship. The first, you can say, punchline I can take from your words, yeah, we should complete everything before internship if we want a good rank in the very first attempt, beta. That's great. Now, you have written all the class notes in the third year, or there was some different strategy, like you take some photocopy or you have written your own notes?
Sir, I have my own sets of notes. Me and one of my batchmates, he also got a like top rank. We used to share our notes. Like usually it's difficult for one person to write all the notes. So he used to write some of them. I used to write some of like my own. But then for when we exchange our notes, we go to the live lectures all over again. So it's like I'm experiencing your work, but now a set of handwritten notes is in front of me. I have never used any photocopied notes. They are often not updated, and there is not that feeling that it's my own notes, which I get from like sharing our own personal notes. So we have always handwritten our notes, and most of it was finished in third year. And finally, a little bit of obs gynae, a little bit of surgery was left. That was finished.
The second important point I'm taking from one of our topper, we should go with a group study and we should do a smart study. Like if you are in a group, it helps a lot. You share your notes. That's great. That's again a good advice you are sharing with all the students with us. So you have written all the notes in the final year. When you started doing MCQs with them?
Sir, MCQs, my strategy is that if I read a topic, I will do the DAMS Qbank from that topic almost immediately. There are two strategies for solving MCQs. One is to do it with the topic which I did, and sometimes like down the line, if I let's say I want to revise ENT, so I will make up a custom module for ENT, and once my subject is over, I will do the entire custom module of 100 questions maybe. Now I've already done the Qbank parallelly with the notes. Now just to revise, I'll use the DAMS Qbank's custom module and just revise the entire topic in a few hours. So these are two strategies I used for like Qbank. I started it in the very beginning itself. Right when my notes were started, I started playing around with the Qbank. Subsequently, as in my senior years, it became more and more intense. More and more questions I solved in a sitting, but I started very early.
That's very nice, Peter. You started doing MCQs early. Now I'm asking one question. Listen to the question carefully, and you should reply. You should give your best experience. Like you are attempting all the questions from DQB, from SWT, from the grand test, and you appeared for the last INICET examination. Where was the difficulty level, Peter? What was the difficulty level?
Sir, I would say that the INICET questions were trickier. They were not exactly difficult, but they were trickier. They are meant as a trap. Like they want you to make mistakes. But the Qbank questions, they will prepare you for the obvious stuff. Now, the important thing to understand here is that if you don't know the obvious stuff, you will definitely make mistakes in tricky questions. So the Qbank gives you a great foundation. Do not expect to find a question directly out of Qbank. That is very like unrealistic to expect. But what the Qbank does is the question that can be framed around that topic, it will prepare you for that. The question and the explanations of the Qbank. Let's say there's a CSOM question. So now I have solved the question and I have now completed the topic around the explanation. Now, anything comes from that in INICET or any exam for that matter, I can solve it. So this is the benefit of having Qbank. Some people think that Qbank se seedha question aa jayega. It often doesn't happen because there are different people. Different people are setting questions across 4 institutes. But I will say it's very important that you get to have a feeling how to solve questions. There's this thing called gut feeling when you narrow it down to 2 options and then you feel ki mujhe iske liye jana hai, which is very important in INICET because there will be several questions like that in which you have a gut feeling. That gut feeling develops only when you solve questions year after year. So that is, I think, the most valuable part of solving a Qbank.
But like what I'm asking you, the quality of MCQs, like you appear for DQB, what I always say in my lecture, okay, DQB is the doable question bank. So like we are doing some unwanted difficult MCQs. What I have discussed with many students, okay, they are running behind multiple difficult MCQs. Against that pattern, we should follow one doable set of MCQs and we should focus more on the classroom.
Yes, sir. I completely agree with that. See, simple things are tested first and then difficult things are tested. The ranks are decided based on simple things. Like maybe the top 10 ranks are decided based on difficult things. But after that, everything comes from like simple things only. If our foundation is not clear, that which from our usual Qbank we get, we will not be able to solve the difficult questions to begin with. Because simple question nahi ban raha, to like difficult question nahi banega. So that is very important, sir.
Now, many students, what the blender they are doing, what I feel, because we are discussing with 100 of the students, especially after the INICET examination, but one step is doing DAMS class notes. And what is the next step is doing doable MCQs. Some students are doing directly MCQs without the class notes. What is your advice, Beta? Because you are getting rank 44 in the very first attempt. So you are the best candidate to share with the student because you were having the minimum time. You got this rank in the internship. You were doing internship from one of the most difficult, you can say, institute where we have very disciplined and strict internship. So how you manage better? Like what was the basic strategy? First doing the MCQs or first doing the class notes?
Sir, of course, first you have to do the class notes because if you want to solve a question, you need to have the knowledge. If you just go on and solving a Qbank, jisme out of 15 questions, you got 12 wrong, that is a very bad feeling to have to begin with. You want to get 10 correct and 5 wrong maybe. That is only possible agar tumne notes pehle kiya hai. I know some people want to skip the step and I want to solve questions first. I would not discourage anybody from solving questions, but understand you solve questions to get them right. That is the ultimate goal. It is only possible if you know the answer. That is only possible if you have read the notes. It's only possible if you attended the class. So classes, notes, MCQs. This is a usual pattern.
You are the part of DAMS for the last 4 years. You must have witnessed all the live lectures of eMedicoz. You must have seen all the recorded lectures where you compare these two platforms, different platform, live platform of eMedicoz against recorded platform of eMedicoz.
Sir, I have tried to attend as many live classes as possible. If not on the day itself, I would almost attend in the same week or the same month itself. I would never, let's say, keep it for several months for that matter. I would say that the beauty of a live class is that, of course, there is the student-teacher interaction to some extent, even though the chat is not comparable to a live class face-to-face, but it's still a good experience. When we see recorded lectures, the thing is that after a little, if it's a long lecture, somewhere in the middle, you feel like taking a break and then that break becomes the entire day. So that flow is broken. So I would recommend if it's possible for you, everybody's situation is different. If it's possible for you, please attend the live classes. And I'd also say not simply the videos per se. DAMS has 3 other sets of content also that I have liked really very much. One of them is their integrated MCQ pattern, which is absolutely amazing, where there is a 2-3 teacher perspective on a topic. I'll also recommend people to attend the clinical grand rounds of DAMS. They're also extremely amazing. And third is the INICET PYT module. Before going into your INICET exam, attend the PYT module. And these are the 4, like, I'll say, pillars of DAMS live classes. Your basic videos, class videos. You have your like clinical grand rounds. You have your integrated MCQ and INICET PYTs. If you have covered these 4 pillars, now there is nothing left for you to know. All you have to do, and if you can make notes for them, well and good. Otherwise, class notes are enough. You can just see the others. The notes are mostly uploaded in the notes section. Just go through them. You will gain a kind of perspective that is holistic. We need confidence in INICET exam. That only comes if we have learned well. That comes if we have attended in a holistic manner. You cannot simply do one thing and believe कि इससे हो जाएगा. Understand कि if this content is out there, it's out there to help you. So these 4 pillars, if they're covered well, I believe from DAMS eMedicoz, I've done it over the. I am a huge fan of the internet MCQ model. I was seeing them even before the exam, just to like a change of pace for that matter. They're amazing. I would say these are the 4 main pillars of DAMS like classes.
Thanks for all the compliments. What I'm getting from you, okay, you should revise the class notes. You should learn the application of the class note, which is missing in most of the students. They directly jump on the MCQs and always follow the disciplined learning of live lecture. That's very true, beta. Now coming on the next segment, pattern. Like the pattern was changed. What was your feeling
Yes,
before
sir.
the examination, in the exam, and after getting this rank, beta?
Sir, I was extremely, I know a lot of people felt differently, but I was extremely thrilled with the pattern change. The reason for that is when we do a 200 question module, somewhere around the 100 question, 110 question mark, we feel a little lazy, a little dizzy, like, chalo, we are halfway through, long way to go. Now AIIMS has beautifully divided that one long exam into 4 small exams.
Agreed.
That is
Absolutely.
amazing for me. So now my concentration span is only of 45 minutes. Then I lift my hands up a bit, stretch a bit, and move on to the next section. And once that section is submitted, now I don't have to worry about it. A lot of people thought ki I cannot go back to that section. Well, leave that section. That is ancient history now. Just focus on this section, the coming sections. So now I have very little distractions. I can focus on the question in front of me. And 45 minutes or 50 questions is pretty good, even for AIIMS paper standards. We got a decent amount of time also, which 200 mein 180 seems like a little less, but 50 questions till 45, now it becomes much more doable because now you're in that a fast mode. So I believe that pattern definitely helped me. It was, I would say, I would credit the pattern to some extent for me being able to do well in the exam. I would say whatever changes, my INICET usually tricks and test students' mentality also with their pattern changes and all that. Last year, they had 2 sets, like different sets, one in morning, one in afternoon. They try doing these new things. Don't be afraid of it. Everybody has to go through the same experience. You're not alone. So just go and approach the exam with a smile, set a strategy, and do your best.
Very true, Beta. Very true. And very nicely, you are dissecting what the best part I'm getting from your words. You were appreciating the change. One option was
Yes,
we start criticizing and we say, no, this change is there. My performance is going to be on the lower side. And the other option, be positive and just take it in a very positive sense. Yeah, that pattern will help me. And definitely, it is, as a faculty, I feel, is one of the best change they have made. Now, Beta, coming
right,
on.
sir.
Quantitative learning against qualitative learning, because in the last 2, 3, 4 years, COVID era, post-COVID era, there is a big, you can say, big options for the student for running behind quantitative learning. What do you feel as a medico to get a best rank in the very first attempt? What should be done, quantitative or qualitative?
Sir, in the initial years, when we are starting to make our notes and all, you want your notes to be as comprehensive as possible. So at that time, if you want to go a little quantitative, add points from extra books and all that, that is fine. But come down internship, last 1 year, 6 months of your preparation, you have to boil it down to revisable notes. Now, our class notes are so concise in DAMS that even the entire short subject notes are revisable on the last day. I did exactly that. I didn't have any like small notebook for that. But towards the end, you have to make sure that you revise the important topics. I have said this like previously also on an interview, like that it's okay if you have forgotten, let's say, a rare nose malignancy question, but you must not get a CSM question wrong. You must understand what is important. So you need to see, I'll again take the example of ENT. It's okay that you miss a small question, a small topic, but your important topic should be right in your face. Like, understand common things first. Common things are asked more commonly. It's as simple as that. That is why qualitative learning comes in. You need to understand what is important for you. And this will come once you solve previous year's questions, see previous year topics. You will get an idea what are the important topics. That is why qualitative learning. But initially, as a second year, third year student, if you want to expand your knowledge base, I'm not going to hold anybody back by saying ki don't do. Add points from Dhingra if you want. Add points from your institute lectures if you want. That is up to you. But towards the end, make sure that your ultimate goal is to streamline and compile it. Taki it comes down to tumko, in a few hours, you can revise the entire subject. That should be your goal towards the very end.
That's very true. Again, all the medicos who are listening to us, we are able to have Dr. Alpin with us, rank 44. So, Beta, in the next spell, I want to ask you the difficulty level of INICET mock test and all the CBT we conducted against you here for the last deck. What was the difficulty level?
Sir, I will say that the DAMS mock tests that are on the eMedicoz app, they are a little bit more on the difficult side than the INICET exam. The only reason I say this because INICET has a balance of tricky questions. The questions are easy, but we will make mistakes. It's kind of a mind game. But DAMS questions are also a little bit more difficult, which makes sense because you want us to prepare for whatever comes in the exam. The goal is clear there. There is no doubt that. But also INICET exam is a little bit easier and a little bit trickier than DAMS, which is a relatively more difficult and more straightforward. I missed the CBT on that day. I had my day duty. I couldn't attend the CBT on 18th. I really regretted that. But I have attended the DAMS, the mock tests, and the mock test along, I can say it was a little bit more difficult, but it resonates well with the exam. The distribution of the questions I like the most. If 7 questions are expected in ENT, the mock test has 7 questions, not 20 questions. That is what I like very much. You need to know किस subject से कितने questions आएंगे. Even the INICET plays around with it a bit. The trend is clear. That was well reflected in the CBT. I mean, in the mock test, which is something I really appreciated.
That's very nice, and thanks for all these words, Beta. And I feel I'm confident many students will take your words religiously and they will follow your footsteps. Coming to the next segment, Beta, I just want to ask you, okay, what was the experience? Well, which subjects you feel, or which subject should be given more priority for INICET examination?
Sir, INICET, about 100 questions will be out of first and second year subjects only. This is something that has been repeatedly told on this platform by our teachers. Ki 100 questions to Manlo will come from the first 7 subjects, which is difficult to believe because when you're intern, your mindset is more on clinicals. You're attending clinical postings, you are in a clinical world. To imagine that anatomy se 20 question aa jayega is like very surprising to us, but that is the truth. So when you start your revision, start with your first year and second year subjects, the preclinical and the paraclinical subjects. Always start with them and revise them routinely. Because even if you think about, let's say, a subject like medicine for that matter, medicine gets 15 questions maybe, but there will be also path mixed in them, pharma mixed in them. So total, if you see that the weightage of first, second year subjects is huge. Then once you have done that, then in clinicals, the highest weightage goes to medicine, obs-gynae, and surgery. We all know that. And then the rest 50 questions is divided into pediatrics, surgical minors, and medical minors. And thus the entire paper is framed. So it's very important that you understand and give time accordingly. Some of us love a certain subject and you read it for 2 months straight. That is good if you are doing residency in that branch, but you're trying to compile 19 subjects in 1 year, 1.5 years. So you must understand कि जिसका जितना weight है उसको उतना time देना है. You take your first, second year, start with that, give it a good go, a first reading, a first revision, and then you start with your clinicals. After that, you revise the first, second year subjects in between continuously. While for changing up tests, let's say you read ENT one day, you read ortho one day, just to change up your taste. Or maybe ortho is a surgical subject, you want to combine it with anatomy for some integrated learning. You can do that, but your focus should be on first and second year. This year there are like 20 questions on micro, I think. So this is reflected over and over, and this must not be ignored.
Very nicely. First, the basic sciences, followed by medicine, surgery, OBGYN, and short subject are the order for your INICET examination. That's very nice. Now, coming on the next segment, some students, so maybe some of your good friends who were the potential students who couldn't crack the INICET examination. Any message for those students for the upcoming NEET examination?
I will say that if you have attended the INICET exam, even if you haven't cracked it, feel very good about yourself because you gave the best mock test out there. You literally just wrote the best mock test out there, regardless of how the exam went. And you will definitely be confident for your NEET exam now because now you get 30 minutes extra in NEET for 200 same questions. The questions will not be as lengthy as it's in INI. So believe that you have given a really good mock test now. So that is the first thing. Don't be disheartened by the result. It's INICET har 6 mahine mein hota hai. Before you know, another INICET will come up. So for the NEET exam particularly, I will say that now it's time to switch topics a bit. Like now you have done INI based topics, well and good, congratulations. But now go on a NEET mode. Try to solve your NEET PYQs a bit more. Try to attend the DAMS DVT, which is the gold standard for NEET. I think it's from like 12 December, it's coming forward. So you do these topics and now get into NEET mode. Forget about what happened in INICET. The experience you gain from that is invaluable. That will go on with you as long as you go. Now get into a NEET mode. So read the NEET previous year topics, do the NEET previous year's questions, attend a concise source like DAMS DVT, and go in and crack the exam. And trust me, a lot of us have already given INICET. These people will not be writing NEET again. The competition will also be a little bit lower because a set of students have disappeared from the top. So feel a little bit more confident. There are more seats in NEET also, more seats every college, every branch. So be confident. This NEET is going to be a walk in the park if you've attended INICET, because now you have done the hard part. The rest is the easy way. Just revision and previous year's questions.
Very nice, Beta. Very nice views you are sharing on this platform. That what I'm getting from you. Okay, forget the past. Prepare it. Take it as a mock test, because INICET appearing every 6 months. Very nice word. Golden words. Now coming on the last spell, Beta. Any special word for your parents because of whom you are on this platform?
I will say that my parents have always stepped out of the box when it comes to like raising me. I am initially from a countryside small town in like West Bengal, but when I was entering my high schooling, my parents completely uprooted our family and brought us to like Kolkata so that I could get the best coaching. That coaching allowed me to get in AIIMS New Delhi. Now even now right before the exam, they're always like sending me all the best, sending me best wishes. They've never told me ki tumko ye karna hai. They've left me to make my own decisions. I really appreciate that. They have given, not only in academia for that matter, they have also given me good life values. They have taught me what is important in life, the value of financially managing yourself, the value of understanding what is important, like the good stuff. I will say ki my parents have somewhat shaped my current adult personality. As a child, I didn't appreciate it much because you don't like to have strict parents. Nobody, like no child like. But the more and more I grow, I understand that how important were the lessons what they taught me, because now I'm an adult. I'm making money myself. I'll be making money for the rest of my life. So now they have taught me all the things I need to know to survive in this world, in a extremely competitive environment, in a relatively difficult time when it comes to the struggles of mental health and all. My parents have given me exactly what I need to survive. They have taught me how to be around people, how to respect my peers, children, women. Everything has came from my parents only. My mother is a nursing officer. I have gained a lot of professional experience for her, that no matter however sleep deprived or whatever she was, she would never be late for duty. That is one lesson that she has taught me through her life. She hasn't told me to do it. I saw her do it. My father is a graded administrative officer. He has taught me the administrative things, how you work with people, how you delegate work, how you take up responsibility. So their professions have also taught me something in my profession. So I will say there is, I would say you cannot imagine being on this journey by yourself. You need a good, strong support system, and that has to start with your parents.
Convey our regards, Beta, and I feel this success is their success. You should convey our regards to them. And last few words for DAMS family, Beta.
Sir, I would like to go like teacher by teacher, but I haven't attended the first year subjects because I joined in second year. I don't know if Ankit sir is like still there. I don't see him like very much these days, but I think like Thiru sir is also amazing when it comes to pharma. In our patho time, that time ma'am was not there. There was another ma'am that time. Mamta ma'am was in micro that time. I think that has also changed now. Sir, but the clinical faculties are more or less similar. Of course, I have to give a shout out to like radio Sumer sir and Obs Gynae Dipti ma'am. This has been like the set of notes that you cannot hold. And not only that, their routine guidance. I once met Sumer sir before joining DAMS. I didn't make this like decision of him. I went to his office and met him because he was in like Delhi only at that time. And the guidance that he gave me that time, how you should approach your MBBS, how you should approach your PG preparation really helped me down the line, because he's a very cerebral person. He talks absolute facts. I really like that. Dipti ma'am is that like the ray of sunshine who's always smiling, giving us good advice, treating us like our children. I really like this holistic family vibe that comes out of DAMS. It's not a professional environment so much, it's more of a family type environment, which is very important when you're spending 3-4 years in this journey together. Of course, sir, I should have mentioned this before. Sir, you always said to be a fast learner. Sir, I have always focused on reading my notes as quickly as possible. Even if I miss a few things, I can always revise again. I can read 3 times fast rather than reading 1 time slow. That is something I picked up from your classes and whatever you have told me. Other than that, sir, big shout out to each and every faculty out there. Our Gaurav Patel sir from surgery, his notes are amazing. All 4 of our medicine faculties are equally brilliant. I can go on, but you get the point, sir.
Thanks for all these compliments, and Beta. Honestly, since morning I'm taking interview with the student. The way you are explaining all the things very maturely, very excellent, Beta. And I'm confident you will excel whatever branch you are going to join in the Central Institute. We wish you very best of luck. And Beta, thanks for coming on this platform. Thank you, Beta.
Thank you so much, sir, for the opportunity.
Thank you, Beta.